Hello everyone and welcome to our Lunch and Learn session on CaBA's Health and Wellbeing Evidence Base. For those who don't know me, my name is Rebecca Duncan and I am the PR and Events Coordinator at the Rivers Trust. We normally have these meetings as an internal thing across the Rivers Trust movement, but this is a special occasion as we've opened up the event to people from CaBA partnerships. So special welcome to all those from non-Rivers Trust organisations today. I'm just going to quickly run through our housekeeping before handing over to my colleague Lucy Butler to start off today's event proper. First of all, we do have captions available for the event. You can enable those by heading to the little CC button, closed caption, at the bottom of your screen and clicking show subtitle. And then you can also adjust the size of the subtitles by clicking that again. We also have a Q&A towards the end of today's session. Please submit your questions via the actual Q&A function, and then you can give general feedback comments in the chat function. And then finally, just to note that this webinar is being recorded. Most of you aren't on camera, so not to worry. And here's Lucy Butler to introduce today's event. Thanks.
Hey. Thanks, Rebecca, and good afternoon, everyone. I'm Lucy Butler from the Rivers Trust and also part of the Catchment-Based Approach Technical Support Team. And welcome again to this webinar on the CaBA Health and Wellbeing Evidence Base. So today's webinar is funded by the EU Life Integrated Natural Course Project with support from CaBA. And I'm really pleased today to welcome and introduce Ellie Brown, who's presenting our webinar today. Ellie is the Strategic Evidence and GIS Manager at Ribble Rivers Trust, and today she's going to be taking us through the updated health and wellbeing evidence base that she's developed and providing us with some guidance on how to use it and how to access the data. The link between health and wellbeing and connection with nature and green and blue spaces has really been rising up the agenda and receiving more and more attention, and I think this is a hugely important piece of work that Ellie's done and a really valuable resource that I hope you'll all find really useful. So as Becca said, if you've got any questions during the webinar, please post them in the Q&A function and we'll have some time at the end to cover as many as possible. But for now, I'm going to hand you over to Ellie. Thank you.
Thank you, Lucy. I will share my screen. Hopefully you can see that now.
Yeah, we can.
Brilliant, thank you. So hi everyone, my name is Ellie Brown. I'm the Strategic Evidence and GIS Manager for Ribble Rivers Trust. And what I'm going to do today is I'm just going to update you on some analysis and mapping work that I've done to help create a decision support tool that's aimed at helping you to identify where creating publicly accessible green and blue spaces or improving people's access to high quality green and blue spaces could have the greatest benefits for greatest health and wellbeing benefits for the populations that are most in need of this. So this is an analysis that I've done across the whole of England earlier this year, and it's been done using data that is made available from leading national bodies. And some of you might have actually attended a webinar similar to this last year that I did in August that related to a previous iteration of this work. But I've since updated and upgraded the analyses since that webinar and have incorporated some new data sets as well, with the results being this upgraded evidence base and decision support tool. So if you have been using data from the previous iteration, just to let you know that that will be deleted by the end of August and this new set will completely replace it. So in terms of the structure of the webinar, what we're going to do is we're going to have a look at what's included within this new updated health and wellbeing evidence base. For a couple of the key data sets, we'll look briefly at the analyses that were carried out to create those data sets. I'll give you an example of how Ribble Rivers Trust have used this evidence base to design projects that combine environmental improvements and improving health and wellbeing of communities in areas that are most in need across Lancashire. We will talk briefly about how you might use this evidence base to engage with local authorities or public health bodies and local communities. I'll demonstrate the various ways that you can access this data yourself. And then, as already been said, there will be plenty of time at the end for questions, hopefully about 20 minutes. And so if you do have any questions that come up throughout the webinar, if you just stick them in the Q&A chat, that'd be brilliant. Thank you. So why do we need this evidence base? As Lucy said, it's now very well documented in evidence how access to blue and green space, so outdoor spaces with water and greenery, has a really positive impact on health and well-being. So just a very quick internet search comes up with loads of articles from leading health organisations and academic institutions and so many other places around just how important it is. And also, on the other hand, obesity and inactivity can put a huge strain on the NHS. So the overall cost to the economy of physical inactivity in England is estimated to be £8.2 billion per year. So if we can encourage people to be active outdoors, that can have big benefits for our NHS as well. But additionally, there's also a hope that if people access the outdoors regularly, they're more likely to appreciate it and to look after it. So the reasons for creating this evidence base are manifold, really. So what is the evidence base? It's an England-wide series of data sets, about 32 of them, I think, that form a decision support tool that is aimed at helping you to identify where creating publicly accessible green and blue spaces, or improving people's access to those spaces, or encouraging local populations to access the outdoors more, you could have the greatest health and wellbeing benefits for the populations that are most in need of this. And that doesn't just have to focus on formal public open spaces such as your parks or nature reserves, but it can also be looking at things like creating paths along rivers or through woodlands, or getting local populations active outdoors through practical volunteering activities. So the evidence base consists of a number of data sets. Some of them look specifically at the current health and wellbeing issues that are within local populations. So it looks at things like levels of obesity and inactivity related illnesses within populations, levels of excess weight in children or obesity in adults, and levels of inactivity in children and adults as well. There's a data set that looks at what area of accessible green and blue space populations have within their local areas. There's a couple of data sets that look specifically about the impact that local environments could be having on people, and so where you might be able to do something to help that. So there's a data set on there that looks at the percentage of deaths that are thought to be caused by particulate air pollution, and then another data set that looks at where those high levels of particulate air pollution are being emitted. And then there's a series of other data sets that just help you to figure out what's going on in an area or how you might be able to best tackle an issue. So things like what the population structure is like in terms of age and ethnicity and religion, what the levels of deprivation are, which GP practices cover certain areas, what the levels of public transport accessibility is, and what the crime levels are like, and all sorts of different data sets like that. And so actually, just to say before we delve into things, that all of the data that you are going to see is available in multiple formats. So no matter what your GIS capabilities are, even if you don't have GIS capabilities, even if you've never heard of it, you will be able to view this evidence base in one form or another. So you can view the evidence base on a fully interactive online map. All you need is internet access, that's it. If you have ArcGIS online, you can add the data sets into your own online maps. And if you have desktop GIS, you can either download the data or pull it directly from the web and display it in your desktop GIS, and that works for both ArcGIS and QGIS software. But we will come back to this later on. That was just to make you aware. So let's have a look at some of the data sets that are held within the evidence base. So as I've said, for some of them, we will look a little bit closer at the analysis process that was carried out to create the data sets. And we'll start with this one because this is a really key data set that is now available to you. And this is an overall map that summarises the current state of health and wellbeing in terms of areas that have the greatest issues with obesity, inactivity, and the illnesses that are associated with obesity and inactivity. And in all the maps that you're going to see, the darker the blue, the greater the problem is, or the greater the opportunity to make a difference, depending on how you look at it. So on this map, the darker the blue, the greater the levels of obesity and inactivity and illnesses that are related to obesity and inactivity, and so where actions to address inactivity and obesity are likely to have the greatest health and well-being benefits for the local populations. So we'll just zoom into an area of Lancashire just so you can see the data a little bit more closer up. We've got Preston and Blackpool and some other urban areas as well. So the majority of data sets that are within this evidence base are reported per, the statistics are reported for each middle layer super output area, which is a census boundary, and essentially it splits areas of the country up into really manageable amounts. So they're called middle layer super output areas. I'm just going to call them census boundaries or census areas because that's a lot easier to say. But that's just to demonstrate that a lot of these data sets are available with really quite fine level detail. But we will come back to this data set. And actually, just to say, for all of the health related data, wherever feasible, I've used pre-COVID data sets rather than data that has been collated within the last 18 months, just because the data sets and the data providers themselves say that reporting of statistics might have been affected during the earlier stages of the pandemic. So data from 2018 and 19 has been used in preface to data that was collected in 2019 and 20. So this is an overall summary map of the health and wellbeing issues within the areas, but then you can delve into the specific data sets that are fed into it. So if you are only interested in seeing where the greatest levels of these illnesses related to obesity and inactivity are, you can view a map about that. You can view maps around individual illnesses as well. And in all these maps, again, the darker the blue, the greater the issue. So on this map, you can see on screen now, the darker the blue, the greater the overall levels of illnesses that are related to obesity and inactivity. What is important to note that is, although all of these illnesses are related to obesity and inactivity, not all cases of each illness will have been caused by obesity and inactivity, but it's just impossible to distinguish the causes of illness from the data that's available. But this is another point that I'll come back to later on. And a lot of the maps, if you're viewing them online, you can click on an area on the map and you'll get a pop-up. And in that pop-up, you'll see information relating to statistics around the local population. So the percentage and number of the local population estimated to have each illness. It will also give you details seen in red on this pop-up if there are any other data sets you should view in combination with this one, which will highlight areas perhaps where there was missing data or there's limitations in the data that you need to be aware of. For a lot of this health data, you can actually also, as I've said, you can look at specific illnesses and view maps for that illness, because there might be a specific illness that you want to target through your work. So you might look to work to try and alleviate depression in adults in some problem areas. So all the data sets that relate to health, illnesses, the presence of illnesses within local populations, that data came from NHS Digital. And it's actually in the form of a series of really useful Excel-based data sets that contain a huge amount of information that's collected from GP practices every year. Most of it wasn't useful for this, this analysis, but is hugely useful for the NHS. And actually within these huge spreadsheets, there are statistics from each GP around the percentage of their registered patients who have certain illnesses, including those ones that are related to obesity and inactivity that we are interested in. And handily, there's also a data set online that shows the catchment outlines for each GP practice. And so each catchment area on the map has a row in each Excel table that it relates to, and you can just join the two together to present information on a map about the levels of the percentage of patients within each GP practice that have an illness in an area. However, hopefully you can see, or maybe not because it's a really messy map, but GP catchment areas are not mutually exclusive from each other. They do overlap. And you can get some areas that are covered by 20 plus GP practices. So the question was, how on earth do you present these health and wellbeing statistics that are reported by each GP practice in a usable format that allows people to identify priority areas that have the greatest issues with health and wellbeing? So there was a lot of head scratching, a lot of trying different methods, and I'm going to present the one that we kind of decided on. So the statistics are presented for each GP practice. but I've converted the statistics into statistics based on each of those census areas, those middle layer super output areas, so there wasn't overlaps in data. And I did that via a process that used weighted averages. So you can see for this census area, which is in Craven in North Yorkshire, just because that's where I live, there are 7 GP practices that overlap this census area, and they're highlighted by the light blue outline. But rather, so for each of those GP practices, we know the percentage of patients that are registered with that practice that have an illness, in this case, diabetes. So rather than just taking an average of those numbers, those percentages from all the GP practices that cover the census area, to calculate an average percentage of people with an illness within the census area, I actually weighted those percentages based on the proportion of the census area that each GP catchment covered. So those that cover a large proportion of the census area will contribute more to the calculation than those that only cover a small proportion of the census area. So if we look, hopefully you can see my mouse, the statistic for this GP that's got red writing with associated it will only contribute 2.38% to that calculation, whereas this one that's got the orange writing associated with it will contribute 44.46% to the calculation, and so on. So in this case, the average percent of people in this particular census area that are predicted to have diabetes is 6.61%, and that has been calculated using that weighted average approach. You can see that this GP practice whose statistics are reported in pink writing, I didn't include those statistics within the calculation because that GP did not report what percentage of its patients have diabetes. And so by not including GPs who don't report those statistics in the calculations, it hopefully helps to reduce the impact that missing data has on the resulting data. And any outliers within the data were not included either, again to hopefully reduce the impact that those statistics have on these averages. And this whole process was carried out for each illness to create a map that looks a little bit like this. So this map here reports the percentage of people within each census area that has, in this case, high blood pressure, hypertension, and that's based on that weighted average approach. Hopefully you can see, but maybe not quite, that the census areas are actually outlined by light grey boundaries, and there's also some black boundaries on the map as well, and that they show clinical commissioning group boundaries. So a clinical commissioning group is a group that commissions hospital and community NHS services in the local areas that they are responsible for. And Public Health England report a lot of their statistics, including the ones that we are interested in, at the clinical commissioning group level, which is hugely useful to them. But it's a much lower resolution data that doesn't highlight small areas that have large issues with health and well-being. And the reason for showing you this is that I personally wanted to see how my results compare to those that Public Health England publish as a bit of a quality control exercise. So hopefully you can see that for each clinical commissioning group that is coloured dark blue on Public Health England's map on the right, you can see that they're made up mostly of darker blue census areas in my map on the left. And for each clinical commissioning group area on the Public Health England map on the right, for those that are light blue on their map, hopefully you can see that they're mostly made up of light blue census areas on my map on the left as well. So even though I was looking at much smaller unit areas, and so there will be some variation within each clinical commissioning group area on my map, on the whole, the trends are pretty similar, which is quite nice to see. So for a given illness, each census area now has a statistic about relating to the estimated percentage of a population with that illness. And I combined that with population data from Office for National Statistics to estimate the number of people within each census area that has an illness. And so both of these tables and the associated maps, the darker the blue, the higher the percentage or number of people with that illness. I then converted the percentage of people within a census area with an illness into a relative score between 1 and 0. So the area with the greatest percentage of people with an illness received a value of 0, and all others received a score less than 1 that was proportional to how much lower their percentage of people with an illness was. And then I also did the same to convert the number of people with an illness into a relative score between 1 and 0. So using that same process. So the area with the greatest number of people with an illness received a value of 1, and all of us received a score less than 1 that was proportional to how much lower the number of people with an illness was. I then took an average of those two scores and again converted it into a relative score between 1 and 0 using that same principle as previously. And what that does is it gives a measure of the levels of people with an illness within each census boundary and how that relates to every other census boundary within the country. And so that does take into account percentages and number of people with an illness, but it's not based on absolute values. And the reason for using levels as a measure instead of the absolute values is that, again, hopefully you can see my mouse, there are some areas, so darker blue areas, where there's a high percentage of a population that has an illness, but because it's a really small population, that equates to not very many people. And there are other areas that have a high number of people within the population that have an illness, but because the population is so large, that doesn't relate to a very high percentage of the population. But then there are other areas where there's a high number of people with an illness, and that relates to a high percentage of the population. So these are areas where there is a real issue with this illness or combination of illnesses, and where if you were to come up with measures to help address this issue, you could have the greatest benefits. So if we're looking at these maps on the right, this area in the middle that's kind of a yellowy colour is Colchester, I think. So if we're just looking at the percentage of a population in that area that have an illness, it's quite low compared to the rest of the country. But if we're looking at the number of people with an illness, that's quite high compared to the rest of the country. So overall, it's kind of a medium priority in terms of the levels of an illness within that area. But then if we look at this community around the coast, there's a really high percentage of the population that have an illness, and that equates to a lot of people. So overall, there's clearly a real issue in that area with the illness, and so that might be where you would look to address the illness first, because you could have the biggest benefits for what you invest in the project. So this is the result of that process, looking at statistics for depression in adults. And you can look at data for specific health issues to identify areas with the greatest levels of each issue. So these are the areas with the greatest levels of depression, where there are a lot of people suffering from that issue and where they make up a large percentage of their population. So again, the darker the blue, the greater the levels of depression amongst adults relative to other areas of the country. And it might be that depression is an issue that you specifically want to target through your works. There are similar maps for each of the illnesses that are listed here, all these illnesses that are associated with obesity and inactivity. There's also this map that you can see on screen now that shows the levels of all of these obesity and inactivity related illnesses combined. So the darker the blue, the higher the combined levels of these illnesses. And again, you can use pop-ups to get statistics for each of the specific illnesses. There are links in that pop-up that can take you to the raw data from NHS Digital, so should you want to go and have a look at it. Again, there's details of data sets you should view in combination with this one to see where there are gaps in the data or limitations in the data that you need to be aware of. So the NHS Digital data is the best data that is available, but as we've already seen, there are some GPs that don't report their statistics, but I have tried to account for those gaps in the data through the process of calculating those weighted averages. And so, oh yes, as I just mentioned, that pop-up shows red writing around which other data sets you should view in combination with this one, and this is the result that highlights those areas with missing data. And it doesn't mean that you shouldn't use data in those areas. It just means you should be careful when you're interpreting the results in that area. So if the data in an area that has data missing differs wildly compared to the areas that's immediately around it, you should maybe question whether you trust the results in that particular area. And I would say maybe don't interpret areas as hard boundaries. So look to see what the trends in an area are, to see if in general there are high levels of illness within the general area. Because remember that the statistics are reported at a GP practice level, not these census boundaries. I've converted them, but so yeah, I would have a look at see what the general trends in an area are. So we can look to see where areas with the greatest level of obesity among adults are. So this is also data from NHS Digital that was reported at the GP practice level and then went through that process I've just demonstrated. Again, just look for general trends in an area to see if an area on the whole seems to have issues with obesity, and those issues seem to be greater than other areas of the country. Because it might be that you want to design a project that specifically targets adult obesity in at-risk communities. Or it might be that you specifically want to look at tackling excess weight among children. So these statistics were actually reported for each of these census boundaries already, so I didn't have to convert the data in the same way that the other was, but I have again used the statistics relating to the number and percentage of children within each census area that has excess weight to calculate the levels of children with excess weight. And so the darker the blue, the greater the levels of excess weight in children compared to other areas of the country. Again, click on the pop-ups to get specific stats around the number and percentage of the local childhood population with excess weight. And this data set was actually reported for reception and year 6 children separately. I've combined them to give them this overall picture of the levels of children with excess weight, but you can view the data for each individual age group in isolation from each other via different layers. There are maps that show levels of inactivity among adults, and this is reported at district level. Again, I've converted it to show the levels of adults that are inactive in each district, because it might be that you would like to design a project specifically to get adults more active, and you'd like to see where that would be of most benefit to the local populations. Or you could be looking to design a project working with school children to increase activity levels, and so this map can enable you to see where that could have the greatest benefits in those darker blue areas. So we saw this map right at the start, but hopefully there's a little bit more context to it now. So it shows the levels of obesity, inactivity, and related illnesses combined. So I mentioned a few minutes ago that for illnesses that are associated with obesity and inactivity, not all cases of each illness will have been caused by obesity and inactivity. We just can't distinguish that from the data, which is why this map is useful, because it combines the relative scores relating to levels of obesity, levels of inactivity, and levels of those related illnesses. And so on this map, the darker the blue, the greater the levels of obesity and inactivity and illnesses that are related to obesity and inactivity. And therefore, where there is likely to be a link between obesity and inactivity and those illnesses. And so actions to address inactivity and obesity are likely to have the greatest health, well-being and societal benefits. I have made available that data set that shows GP catchment areas. Should that be of use to anyone if you're trying to organise, say, a green prescribing project or something like that. If you click on an area on the map, you can see the name of the surgery and other details. So there's also quite a bit of data within the evidence space that can help you to figure out what's going on in a population. So why are there high levels of certain illnesses, and what might be the correct approach to address those issues and so on. So you can look at the age structure. Sorry, you can look at the age structure of a population and the diversity or lack of ethnicities and religious beliefs in an area, because these things all affect the behaviours of the local population, including the likelihood of them making use of their local green spaces and exercising outdoors, and it should certainly affect the methods that you will use to try and address those issues. So, for example, there are some coastal villages within England that have really high levels of obesity and inactivity and related illnesses, and looking at this population data, you can actually see that's because there's a really large retirement population in those areas, which can help you to figure out why those illnesses are occurring. So this data set actually does include some 2011 census data, but it will be updated with the 2021 census data when it is available, but at the moment it isn't, unfortunately. I've also made available this data set that shows the index of multiple deprivation, which is published by the Ministry of Housing, Communities and Local Government, because again, that could help to explain some trends in health and wellbeing, or could help you to determine the best methods to address the issues that are in the area. So that's the health and wellbeing side of things. And now we're just going to look at another key data set that relates this time to the environmental side of things, and it should hopefully help you to identify opportunities to improve the environment for the benefit of people's health and well-being. So this data set shows the area of accessible green and blue space per 1,000 population. And by accessible, I mean the amount of green and blue space that is available for people to experience, the public to experience. So areas that they can directly walk within a green space or alongside it, say along a river and so on. So it incorporates data relating to those official public open spaces, so your open access land, your doorstep greens, your green spaces, your nature reserves and so on. But then also those unofficial ones, so where there's public rights of way or footpaths running next to a river or through a woodland or through some fields and so on. So the white areas on the map are the formal registered public open spaces, like your open access land, your registered green spaces, your nature reserves and so on. And then the black hatched areas that are over green public rights of way lines and orange footpaths, those are the unofficial green and blue spaces such as rivers and woodlands and fields that are experienceable from paths and cycle routes and so on. Because if we the reason for running this analysis is if we only factor in the official public open spaces, those areas in white on the map, we can underestimate just how much green and blue space people have the option to experience in their local areas. And so it could lead to us misidentifying areas that really do have relatively little public open space per 1,000 population. So this data set just enables you to see where in urban areas there's less than the recommended 4 hectares of publicly accessible or experienceable green and blue space per 1,000 population. And if these areas overlap with areas that have high levels of obesity and inactivity and the related illnesses or depression and so on, you could potentially tackle 2 problems with one project. So you could create accessible green and blue spaces in those areas, or improve people's access to it in those areas, giving more people more opportunity to exercise outdoors. But if you include local populations in this process through active outdoor volunteering and getting them to assist with some of those works, you could directly improve their health and well-being through getting them involved in that process as well. So there's this data set around the locations of public transport stops that's also within the evidence base. So if you're considering creating new green and blue spaces, you need to consider how accessible they are, as this will affect whether people will use them. So are there any public transport stops nearby? Are there some that are no longer active that could be reinstated? If you're thinking of running volunteer days or events to encourage people to get outdoors, will people be able to get there by public transport or public rights of way, which you can actually see on the base map if you zoom in. There's also this data set that looks at the levels of crime within the immediate area. So you can look at what the levels of crime are, what types of crime occur. And the reason this is in the evidence base is that the creation or improvement of high quality public open spaces has been shown in some locations to reduce the levels of antisocial behaviour taking place in the immediate area. So by involving people with a history of antisocial behaviour in the development of public open spaces, you can reduce the occurrence of such behaviour, as those individuals might develop a sense of pride or ownership in the areas. And so this could help to reduce crime levels within the area and create an environment where people feel safe to exercise outdoors. And there are some projects where this has been the case. So there are a number of factors that can affect health and wellbeing of communities. So in addition to the availability of public open space, for example. And so this includes, but is not limited to, factors that can impact their ability to exercise and maintain a healthy diet. So there's also data sets within the evidence base that just show how readily available fast food is and the level of access people have to sporting facilities, because these data sets could help you to further figure out why there are certain issues with obesity and inactivity within an area. And there are also some data sets that allow you to identify where the environment is directly impacting on people's health. So this one shows the percentage of mortality in people above the age of 30 that's thought to be caused by particulate air pollution. And this map shows where the emissions of that particulate air pollution are. And so these are the areas where you could do something about it to help those local populations. So you could create public open spaces that encourage people to access areas that are less polluted, or you could create accessible woodlands or plant trees in strategic locations to reduce the levels of particulate air pollution within key problem areas where emissions are high. And you can also organise events that get people active in the outdoors away from these polluted areas to help them to get some fresh air. So hopefully you've seen that there are lots of data sets to help you to piece together where your work is needed the most, where particular types of work could have the greatest benefits for local populations, and the stats to back those judgments up. And the idea is that it can help you to make the best use of your resources, but it also provides the evidence base to help you to bring in more funding to do these types of work. So as an example of how we've used this evidence base, Ribble Rivers Trust and our partners in Lancashire have recently found out that we've been successful in our bid to the Green Recovery Challenge Fund. And for that, we designed a project around this evidence base that aims to improve health and wellbeing of the communities most in need through involving them in environmental action and improving the environment where that is most needed as well. So we liaised with local authorities and the NGOs in the key areas of Lancashire that are struggling with health and wellbeing and lack of access to blue-green space to create our partnership project. So there are many different aspects of the project, such as creating woodlands and wetlands and restoring or managing heathlands and meadows and creating new footpaths to increase accessibility of public open spaces. There's a huge educational element to the project, where we'll be working a lot with school children in these key areas. It's all focused around, or mostly focused around, areas where the evidence base shows local populations could benefit most in terms of health and wellbeing, and also where Ribble Rivers Trust's other extensive evidence base shows us the environment could benefit the most as well. So we'll be running a series of health walks to targeted specifically at the communities with the biggest health and wellbeing issues and a lack of access to blue and green space. And we'll attempt to recruit people from those same communities to help out with the practical environmental works that I reeled off a minute ago. We will be creating a series of community-run micro tree nurseries to provide outdoor volunteering opportunities for people who might not be up to planting trees, but they could perhaps manage sowing some tree seeds and caring for them in the nurseries. So we'll look specifically at one aspect of this project and how this evidence base was used to guide the design of it. So for the micro tree nurseries that I've just mentioned, we will be running a series of health walks with local populations to collect the tree seeds to sow in those nurseries. So the health walks to collect those tree seeds will take place in the orange dots on the maps. So they're all within or on the edge of urban areas that have high levels of obesity and inactivity and related illnesses, where there's high levels of depression among adults, where there's a lack of accessible green and blue space. And they'll also be taking place just outside areas that have high levels of particulate air pollution. So we're going to aim to recruit people from these problem areas to go on these health walks to collect the tree seeds, as these are the people that are most in need of physical outdoor activity in green and blue spaces away from areas with high level of air pollution. Again, on this map, the orange dot is where the health walk will take place. So using more data to evidence where we should carry out this project, we identified accessible, ancient and semi-natural woodland sites on the edge of these problem areas that have footpaths running through them, that have areas that are not too steep and that have bus stops close by, meaning that they should be accessible for a greater number of people who perhaps have limited mobility. So that is just a simple example of how we've used this evidence base. And even though Green Recovery Challenge Fund don't give specific feedback about why a project has been successful in its funding bid, we did have a bit of a discussion with several of the Deprivat reps following our expression of interest, and their feedback from that was that using this data and evidence base gave our application credibility and gave them confidence in the project, which is really nice. So how can you access all of this evidence base and make use of it? And hopefully you've seen that there's loads of data sets that can help you to piece together where your work is needed the most, and the particular types of works that could have the greatest benefits, and the statistics to back those judgments up. And the idea is that it can help you to make the best use of your resources, but also provide the evidence base to help you to bring more funding in to do these types of work. So all of the evidence base is available via the catchment-based approach data hub, specifically the health and wellbeing data hub. And it pulls together all the resources associated with this evidence base. And I will try and do a live demo of it. Let me move that out of the way. So this is the data hub. The recording of this webinar will be on the data hub as well, should you ever feel the need to watch it ever again. There is, if you click on here, an online interactive map that enables you to view all of the evidence base. It's available for everyone to use, irrespective of whether you have GIS experience or even know what GIS is. So it's, as it opens up, there's an introduction to the platform, what the general aim of it is, information on how to use the mapping portal, the space for you to, with my email address in, if you have any feedback around all these data sets, or if you've used them and so on, so you can get in touch with me. The whole thing has been designed to lead you through the data and explain it and help you get the most out of it. So it's been designed as a decision support tool that helps you to see where the issues are within the area that you operate in and where your work could have the biggest benefits for the local populations. And it can help you to design the right projects for the local populations. So there's a series of tabs along the tabs along the top, one for each of the data sets that you've just seen, or perhaps groups of data sets. So you can zoom into your area of interest and then just click between the tabs and it will stay on your area of interest, but update the data that you're seeing. Most of the data sets you can click on to see a pop-up. The information on the right-hand side tells you very clearly whether you should click on a link to update the map to show where those areas with missing data are. Or if there's any other kind of caveats in the data. There is always a link where you can click to access all the background data, all the background information. And that includes information about where the data came from, and the analysis that was carried out, whether there's any caveats in the data, whether it should be viewed in combination with other data sets. And so I've tried to make it really transparent about the whole process, so you have all the information that you need to work out whether this evidence base is fit for the purpose that you want to use it for. There is an option on this story map to view all of the data all in one place. It opens up with some instructions on how to use it, and then you can just turn different layers on and off as you wish and view them in combination with each other. You've still got all the pop-ups with all the information in them and so on. And there is also a tab called Other Resources, because there's loads of other information and online interactive maps online that contain hugely useful information that could also be of help to you when designing projects, such as Natural England's Monitor of Engagement of the Natural Environment survey. Hopefully this loads, which is a similar format and just has loads of other really useful information on there. The whole of this site can be updated at any time. It's really easy to do. So please do let me know if there are any changes that you think would be beneficial to make, if there's any other resources that you think should be listed on this tab and so on. Hang on, let me just move this. The Zoom sharing thing is right over the top of my screen. I don't know how to move it. If you're an ArcGIS Online user, and even if you're not, you can create a free account. All the data sets are available for you to use on ArcGIS Online. Again, you can just go back to the data hub and click on ArcGIS for users, request access. Takes you to this page and you can request to join the group. It's really easy for you to add this data into your own ArcGIS Online maps. You just open a new map, add data, search for layers. Within ArcGIS Online, if you just type in health and well-being, all the data sets come up, they all have this thumbnail, you just add them to your map. And you can see the legend and you can save your map and it's all just saved there. You can also download the data for use in your own desktop GIS. So again, if you go back to the data hub, you can click browse the data and it brings up all the data sets. And if you click on a data set, you can see it. Again, you can view the full details for the data set if you are interested. You can download the data from here or from that previous page to use in your desktop GIS. And you can also pull the data directly in from ArcGIS Online into your desktop GIS, both Arc Pro and Arc Map. So in Arc Pro, if you go to your data catalog, make sure you're signed into ArcGIS Online at the top, click on Portal, ArcGIS Online. Again, if you just type in health and well-being, a lot of the data sets will come up in amongst some others as well. And then you just click and drag them into your map and then they will show. And it's a similar process for ArcMap as well. You add data from ArcGIS Online, you type in health and well-being, those data sets come up, you click add, and they'll draw directly in your desktop GIS. There is a process for doing this for QGIS, but I personally don't use QGIS, so I wouldn't be much use in telling you that. But Leanne, who works for Ribble Rivers Trust and is fantastic in QGIS, has written a guide for QGIS users on how to do the same thing within QGIS. Okay, last couple of slides. So we're going to talk very, very briefly about engaging local authorities and the public health bodies and local communities in this work. So as we did for our project in Lancashire, this evidence base could provide a real starting point for conversations and planning between local organisations and charities for joint projects that could provide multiple benefits for the environment and local populations and make the best use of everyone's limited resources that they have to be able to make positive change happen. If you know where the communities are that are experiencing high levels of these issues, you can arrange activity days with local groups that would benefit from outdoor physical activities. So you could arrange for them to assist with litter picks or pulling up a Himalayan balsam or planting trees. And you could perhaps enlist the help of local groups such as mental health groups or groups that are aimed at helping people to lose weight to reach those people that would benefit the most. You could even, if you wish, to do door-to-door advertising to get people involved. And you could also consult with locals in the area to find out if there is a problem with people not exercising outdoors or making use of their green and blue spaces. You could speak to the locals to find out why that is and involve them in the process of designing projects to tackle this issue, to create spaces that locals will actually use, or to run events or activities that people will actually feel comfortable in attending. You could use those GP boundaries to liaise with GPs in your area to arrange perhaps green prescribing projects. Or they might know of groups that you should approach to get hold of the people who would benefit from your projects the most. You could also work with public health bodies in the strategic targeting of projects that could help save the NHS money. So it could be a real opportunity to combine the environment and health for the benefit of the environment and the health and to reduce the burden on the NHS. And it could lead to some really great partnership projects. Just to finish, just to say, if you do use this evidence base, I would really love to know what people are using it for, whether they find it useful, whether you've had any successes with it, whether it's enabled you to bring funding in or led to partnership projects and so on. So if you could just email me and let me know, I would really appreciate that. But also, if you have any questions, you are welcome to email me as well. And I will finish there because we've not got much time left.
Thanks, Ellie. That was a fantastic presentation, and thank you so much for all the work that you've done to develop the evidence base. It's a really valuable resource, and hopefully everybody will get a lot of use out of it. So we've got quite a few questions that have come through, so we'll take a look at some of those. So we've had one, I think you did touch on this. Can people also download the GIS data? You showed us how to do that, but also, are there any licensing issues, or are all the data open government license?
So all of the data, apart from one data set, are all open data that anyone can use. There was some data that fed into the analyses that wasn't open data, but you can't access any of the raw data or any information held within it from the data sets that are available within this evidence base. So I don't think there's issues with you using any of this data.
Yeah. And there are a couple of people who just said, could you show them again just the link to the interactive map, so how you open the story map, I think, just from the web page. If we could just do that again, that'd be helpful.
Yeah, that's fine. Sorry, I was aware we were running out of time, so I sped through that bit. Yes, so I mean, I can give you a link directly to that web map, but if you go on the catchment-based approach website and then on the data hub, they have a working groups web page, and within that there is a health and wellbeing working group. We can put a link in the chat, can we, Lucy, to that? And then if you open story map, that is where you will access the interactive map with all the data on. And that's free and available for anyone to use. And then from that same place, you can download the data or access the data to put into your story map as well, or view the webinar again.
Thanks, Ellie. And then we've got a question from David Griggs, who said, what method was used to determine whether blue spaces were experienceable, I think, as well as accessible?
So the measure of if they're experienceable is if people can directly access that area. So if they can, they can walk into a park, or if they are walking within a certain distance from a river or a woodland. I've used the term experienceable rather than accessible because it isn't an assessment of who can access it, how accessible it is in terms of whether people have to be on foot to access it or whether wheelchairs can access it and that kind of thing. It's just where there are opportunities for people to see, hear, feel, experience those blue and green spaces. So either directly in amongst it or directly adjacent to it without another habitat in between them. Hopefully that makes sense.
Thanks, Ellie. And a question from Ingo Tudor here, who says the relationship between inactivity and obesity is quite complex. You can have very thin people who are very inactive and suffer from particular conditions that overlaps with those who are maybe obese but very active. Can you say a little bit about how this affects the cause and effect relationships or actions for people wanting to address those issues?
So it might be that you would then look at the individual data sets that just look at obesity or just look at inactivity. And then because it might be that you are wanting to tackle one or the other. So I think you'd drill down into the specific data sets relating to specific issues rather than that combined map that shows on the whole where there's an accumulation of all these issues.
Okay, thanks, Ellie. And a question from John Halton, who said the frequency of public transport services at particular spots is a consideration. The presence of a bus stop is not necessarily a good indicator of accessibility, as some stops are served by few routes or infrequent services.
I think this is all with any kind of GIS analysis, you have this analysis that's based on the best data available, but then you have to take it out into the real world and see whether what you're seeing on the map reflects what's happening in real life. So in terms of the bus stops, you would say, okay, here are the bus stops. How frequently the bus comes to these? As you say, it might be there, but it might be that only a few come a week, or it might be a really regular service. So that's when you'll do more detailed checks on the ground of what, to find out more details around things like that.
Okay, thanks, Ellie. And more of a comment than a question from Gina Rao here. She said, it looks really useful, thank you. Obviously, engagement and involvement is key to tackling the issues once identified where you're going to target. Knowing where there's problems, just one part of the planning. Then developing the suitable community engagement processes needs skilled and experienced input to engage communities who may be apathetic or overwhelmed with housing and income problems.
Yeah, absolutely. This is just to help you to find locations where you could run projects, and then you go and develop them yourselves with the local communities and that kind of thing.
And a question from Andrew Mackey, who said, are there any limitations on the analysis with these layers? Will ArcGIS Online allow us to conduct spatial analysis on these?
That might be better for you to answer, Lucy. Is there anything set up that allows people to do that? Or
so because you can download the layers and pull them into your own desktop GIS, you can then do analysis on the layers that way. You'd need to download them first.
So there's nothing set up on ArcGIS Online that allows that?
I don't think you can actually analyse the layers, the live layers, but you could, yeah, once you've downloaded them, you can use them as you wish in your own GIS software. Yeah.
Okay.
And then we did have a couple of people asking Ellie if you'd be happy to share the slides as well as the recording.
Yeah, that's fine. I'll make some tweaks and then I'll pass it to Rebecca, and then Rebecca can circulate. Is that how it would work?
Yeah, that'd be good. If you do that, we'll look at the best way to make them available to everybody afterwards.
Okay. Yeah, no problem.
That's great. I think that's all of the questions. I think there was lots of comments from people in the chat saying, brilliant presentation. Thanks so much for the work, Ellie. And it's really helpful, and people will be taking a good look at it and hopefully getting a lot of use out of it. So that's great.
Okay, I hope it's used to lots of you.
So I think that's about all we've got time for today. So thanks everybody for joining us and the questions. And I'd just like to thank Ellie again for a fantastic webinar. And I'm just going to hand back to Becca for a few final comments.
Yes, thank you both. And just to echo the thanks to Ellie and everyone else involved in putting that data together. It's absolutely incredible. Just a quick message to say that in terms of the Rivers Trust movement, we're going to have a quick summer break for the Lunch and Learn series. So we won't put a session on in October, but we do have some lined up for the autumn already. So just please keep an eye on your emails for information about that. And then in reference to today, we'll have the recording and the slides, and I'll be able to send those out by email to the Rivers Trust and the CaBA mailing lists. Anyway, it's 1 o'clock on the dot, so that was perfect timing in the end. I'll let everyone go off for their lunch. Thanks all for coming, and have a great rest of your day.